Keenan, and today I want to ask, are you in pain? Are you suffering from arthritis? Have you been told that there's a long waiting list to get in to see the specialist and you don't know what to do? Well, number one, you need to take your healing into your own hands. So many patients that I see are suffering from chronic pain for many different reasons. And with the state of our healthcare system now, I know it can be very difficult to see a specialist no matter where you live. And many times people think, well, I need to see the doctor before I can get better. I need to have that x-ray. I need to have that MRI. But what if you started to look at other ways that could help you to reduce your pain? I know pain is difficult, and I know that it's not easy when you're in pain because it can depress your mood, it can lower your energy, but there's ways that you can begin to overcome it. So one of the things I want you to think about is movement. So a research study was done where they looked at individuals who had osteoarthritis. So this is arthritis of the joints, of the hips, of the knees. And they put them through a series of protocols. So they put groups into those that were told to do basically supportive care. They said, just take care of yourself. And then in the other group, they put them in a physiotherapy or an exercise-based regime. So what happened? Those that went in the exercise-based regime were able to lower their pain by over 30%. Now, this was in just over half of the patients, but they were able to do it with gentle movements. So some of the movements were assisted by a physiotherapist. Others were through swimming. Others were through walking. But they've actually looked at the studies, and in medicine we do what are called meta-analysis, and they see that overall there is such benefit by adding mobility into those patients who are suffering from arthritis. So why would this work? Why would just doing some movement help you to lower your pain? So number one, you're activating your muscles. When you activate your muscles, you're actually supporting your joints. So in particular, this is really important for any type of knee arthritis because the muscles above and below your knee are going to help to support that knee joint itself. What else happens when you move? Well, you activate endorphins. So many of you have probably heard of these natural painkiller cells that we have inside our body. So movement of many forms will help to do this. It doesn't have to be the long distance runners. It can be a 20 to 30 minute walk. It can be going for a gentle swim, but it will help to raise these natural feel-good chemicals in your blood system. And then we think about circulation. So when you're moving, you're drawing more blood to different parts of your muscles. So what does blood do? Increased blood flow is going to activate the muscle for healing. And it's also going to support the anti-inflammatories that will circulate in your system. But I think one of the most important reasons to begin to exercise and to move is that you will feel empowered. You know, I think many times in healthcare, it's really difficult because we often feel like we're the victims, right? Like I can't do this or I have to wait. I need to have this surgery. The only way I'm going to get better is if I do this or if a doctor injects me with a drug or if they replace my hip joint. But what if you said, okay, that might be necessary and maybe I do need to have that in the future, but what is the one thing that I can do now? Because what I've seen time and time again, the body knows how to heal when we put our focus on it. Because where your focus goes is where your energy is going to flow. So if you think the only way for you to get better is to absolutely have that injection into your joint, then probably that's what's going to happen. But if you think, wow, there's ways that I can reduce my pain and improve my healing while I'm waiting for this, and movement can be one of those things that you can begin to do. So when we think about movement, a lot of people will say, well, don't I just need drugs, Dr. Keenan? And isn't this what I need to have? So I wanted to compare movement versus one of the top drugs for arthritis. A lot of people know it. It's an anti-inflammatory that's called Celebrex, right? So we know that Advil and Tylenol can help with arthritis pain, but a lot of patients that I see are also on these stronger anti-inflammatories. So in medicine, we have something called the number needed to treat. And this looks at how many people it takes before they start to get a benefit from a type of therapy. So when you look at the research done for exercise and movement for arthritis, the number needed to treat is 4, okay? So with every 4th person that you treat, you're actually going to get a benefit. So if we look at a drug like Celebrex, the number needed to treat is between 4 or 6. So you might say, well, that's pretty equivalent to movement. True, it is, but it can go the opposite end. It can be 6 to 1. But what else are the potential side effects with anti-inflammatories? Well, even though this class of drugs is much safer than taking aspirin or Advil on a regular basis, we still know that 1 in 100 people can have a bleed into their stomach from these types of medications. So I wanted to put that contrast out there so that, yes, there may be times that you need anti-inflammatories, but if we look at movement, the number needed to treat is even lower. And what are your side effects? Well, you might feel better about yourself. You might actually have less pain in other parts of your body, and you might actually help with stimulating your mood even a little bit more than before. So I hope this just makes you think about what's going on in my life. If I have pain, what are the things that I can do now? So movement, of course, is just one of those things. There's, of course, lots of other things that you can do with a healthy diet, with sleep, with stress, with removing with inflammatory foods. But I really want you to think today is how are you moving and how that might be contributing. Or if you're not moving, is there reasons why, or is there a way that you can get yourself to that point? So I'd love to hear a little bit more about your comments about pain, your perception of arthritis, if there's things that you're doing or if there's things that you want to hear a little bit more about. I hope you all have a wonderful, wonderful day. Keep moving, feel great, live more. Bye for now.